Life Unrehearsed, brought to you by Caregiver Crosswalk, Dementia Care Consulting. Never roam alone.
And good afternoon. Welcome to Life Unrehearsed. I'm Matt Del Vecchio, specializing in life transitions, downsizing, and the senior living industry.
And I'm Corrie Matt, clinical social worker and psychotherapist, specializing in grief and loss.
Coming right up on the first half of today's show, in recognition of Children's Grief Awareness Month, we'll be talking to an incredible couple, as well as our own very own Corrie Matt, and we'll learn how we can best support bereaved children. Corrie, I have to, if you'll allow me, mention, I'm so proud of this. Stephanie, my wife, and I have started a fundraising campaign. You know, I'm very much involved with seniors and seniors residences, and one of the issues CHSLDs are having, and families, is just being able to communicate, right?
Right.
Video conferencing is becoming more and more popular. Visitation policies are very strict, and there's lack of equipment. So we've raised money in this iPads for seniors residences campaign, and we're starting to distribute this week. We've got an event on Wednesday at one of the CHSLDs. We will be distributing 22 iPads, and our secret weapon are these stands for these iPads, because what was happening with the healthcare workers is they were holding the iPads, which was taking up a lot of their time. So these stands hold the iPads, so a resident can talk to their family member, and the employee, the healthcare worker, can go about to do their thing and oversee the whole video. So proud of that, and we're going to be distributing 22 in the next 7 to 10 days.
Well deserved, as you should be. It's so wonderful that you are taking upon yourself with your team and your support to do this initiative, because you're really helping break that sense of isolation, which we know is so prevalent right now with COVID.
Yeah.
So good on you, Matt.
Thank you very much. And thank you to the many donors, individuals, and fairly substantial donation from the Eric T. Webster Foundation, and West Island Community Shares are contributing. So a bunch of people and organizations. So thank you. What do we have coming up in the second half?
We have our very own Jamie Ben-Ezri. I always call him our very own because he's been on a few times, and we just love having him. Here's a question. Can you contest a ticket that you receive due to COVID? If it's a COVID-related offense, well, we're going to talk about that. That's just one of the questions we're going to be addressing in our rapid-fire Q&A with lawyer Jamie Ben-Ezri as we discuss the most popular related legal issues, especially during this pandemic. All of that's coming up after the 4:30 news.
Oh, okay. We love having Jamie on the show. It is quick. We cover a lot. Can you pay rent if you can't afford it? If you want to start a new company. Oh, so many different topics. So that's after 4:30 with Jamie Ben-Ezri. All right. You know, Corrie, on a more and very serious topic, bereavement is a difficult subject for many. Often, because death is a subject that tends to be avoided. It's not comfortable to talk about. And child bereavement can be even more sensitive. And this month happens to be Children's Grief Awareness Month, and we wanted to bring attention to it. So not only are we fortunate to have you, Corrie, this is your specialty with grief and bereavement, but we're also blessed to have a courageous couple that have agreed to come on the show to discuss their own situation of how they are coping with grief and loss. We have Michael Hollander, who's an attorney specializing in civil and corporate litigation at a boutique law firm, and Michael's wife, Dahlia Gutman, is a physician working in the ER at the Jewish General Hospital, and she is also in a general family medicine clinic in Montreal. Together they have 3 children, Ari, Liel, and Ronnie. Welcome to Life Unrehearsed.
Thank you.
Thank you.
Well, thank you, both of you. Firstly, I am so sorry for the loss of your daughter. Thank you for having the courage to coming on the show in such a, I'm sure, a difficult situation for your entire family. And let's just begin, I guess, by telling us your story.
So first, I want to actually commend you, Matt, on this great initiative for the iPads in the hospital. I know firsthand that that's extremely appreciated by the patients and the staff. So congratulations for that.
Thank you very much, Dahlia.
I guess our story, as of last year, let's say, we were just a regular family. We were living a regular life, 3 young kids, work, everyday problems, everyday activities. January 13th of 2020, so the famous 2020 terrible year, it started as a regular day. We sent our then grade 2er to school, and our then 4-year-old was watching her iPad, glued to it as usual. And I went to get Ronnie from her crib, She was singing. She was 2 at the time. She was singing. She was patiently waiting for me. We played. We had breakfast, everything usual. And I walked upstairs to get dressed. I put the TV on for her, as we did every day. And minutes later, I came back, and she was just lying there. I'll spare all the details, but basically myself as a physician, I began all the life-saving maneuvers that I knew, but I knew as well very much at the time that she wasn't coming back to us. It was sudden, it was unexpected, completely unexpected, and so unfair. And to this day, we still don't know why or how she died.
You guys, you are just incredible, unbelievable, and the story is, my heart breaks and I've heard the story before, but it always breaks. Dahlia, Michael, either of you, help us understand, what do people need to know about this SUDC?
You want me to take it?
Go ahead.
So the most important thing is people just really need to understand that it exists. So SUDC, it stands for Sudden Unexplained Death in Childhood. It's not a disease. It's not a cause of death, but it's a categorization that's given to death when the death of a child over the age of 1 is unknown after a thorough medical and genetic investigation, including a full autopsy. So you can think of it, the best way I say is you can think of it similar to SIDS, but in an older child. And forget the sleep, which sometimes it does or does not happen in sleep. But for Ronnie, it wasn't the case. SIDS itself is also, again, like a categorization and not a cause of death. But we know that everybody has heard of SIDS. And why? That's because it's received a lot of publicity, and the publicity has allowed for funding and research into all the risk factors and allowed for advocacy. And we know that the advocacy works because since the 80s, when SIDS was big, the SIDS numbers have gone down with the Back to Sleep campaigns and all the other campaigns that have run around. And this really is what SCDC needs. Mm-hmm. And there is actually a foundation, the SCDC Foundation in the United States, and they're working on bringing advocacy awareness to regular people and most especially to the medical community so research can be directed and numbers can decrease. So myself, just as you mentioned, I'm a young physician and I never heard of this, and neither did most of my colleagues, had never heard of a child over the age of 1 suddenly dying with no reason. And we all think it's very rare, but if you look into the statistics, it's 1 in 400 children in the U.S. that die of unknown causes, which can be classified as SUDC, and likely the numbers are higher because many deaths are misclassified or undeclared. And the fact is that when SUDC or these things are unknown, then the families have never heard of it, and nobody gives them the support they need.
You're listening to Life Unrehearsed as it is Children's Grief Awareness Month, and we're talking to Michael and Dahlia Hollander. Michael, we'll throw it over to you, and I can't possibly imagine just the grieving process that you had to go through. Can you explain a little bit how you personally had to deal with it?
Sure. I mean, Dahlia and I dealt with it, I would say, really differently. In my case, I mean, we had a tremendous outpouring of support from the Jewish community. That really helped, and I know for a fact I lean on the community quite a bit. I lean on my synagogue also quite a bit, both before and after COVID. I really tried to just keep as busy as I could and distract myself with as many things as I could. In Judaism, the grieving process for anybody besides a parent is supposed to last 30 days. I've been saying the mourner's prayer every day except for during the lockdown for pretty much the past 10 months, and my 11 months are coming up in a few weeks. Mm-hmm. But I've been carving out that time for the day to go 2 or 3 times a day as sort of a way to always remember why I'm there, carve out that time for Ronnie. Sure. But in more general sense, it's completely changed how I see the world, how I deal with people, how I spend my time. I found myself becoming a lot more empathic with people. I've tried to do a lot more good in my life and in the world. And overall, it's just, really made me appreciate what I have, I think, a lot more.
Sure. Michael and Dahlia, we want to continue with your story and really take our hats off to you for bringing awareness and support to those that may be in that situation as well. We have to take a quick traffic break, but when we come back, we're going to hear more from Michael and Dahlia, as well as Corrie herself, our grief and loss expert, and we're going to talk more during Children's Grief Awareness Month.
Life Unrehearsed, brought to you by Leanna Senior Transition Support, specialists in downsizing and seniors residences.
And welcome back to Life Unrehearsed. My name is Matt Del Vecchio, along with my co-host Corrie Sirota, and we're talking with Dahlia and Michael Hollander about how we can best support bereaved children. And this is also a topic that Corrie is so well versed in, as she is a grief and bereavement specialist. And after all, it is Children's Grief Awareness Month. We wanted to bring this subject in November. So Corrie, we're going to switch it over to you for a second here. And you really know about children and their grief. Can you tell us some of the key points to remember when talking to children about death and dying?
Sure, Matt, with pleasure. It's so important that we get all very nervous because as parents, as adults, our natural instinct is to protect children. So we don't think, perhaps we think that if we are to say something, that it's going to upset them and it's going to cause more pain. It could not be more of the opposite. You need to be quite simply honest, show love, and say things in a language or use the language that children understand, developmentally appropriate for the age of the child.
Right. No, it makes sense. And there are so many. There are so many other key points. Which ones seem to be some of the most popular ones as well?
Well, I think there's a concern about, again, sugarcoating. When I say use the right language, we say things, we all do it, passed away, gone, lost. We need to be very clear. Kids have what I'll call built-in lie detectors. They know and they watch and they see what's going on. So they will watch your actions, and if your actions and your words don't match, plus they're very literal. You tell a child that someone died by accident, they think an accident is they peed in their pants. Or you tell a child they went to sleep, you try and get a child to go to sleep after that if sleep means you disappear and never go away. You also don't want to tell a child that someone was sick. You want to say something like very, very, very sick, sick that could not be fixed. Again, so that they don't conjure up in their minds something or send them the message that you can't ask me these questions. Right.
So such words of advice that I think we could all learn from. And I just want to wrap it up because you always talk about this, that grief is long lasting. It's just not a short-term event.
Well, this is the thing, is that no two people grieve the same way, nor do two children grieve the same way. So remember that your grief is your grief and their grief is their grief. And at the same time, we don't get over grief. We learn to live with it, particularly with children. As developmental stages, they change and understand things at different levels. So we always got to be mindful that it's a lifelong process.
Right. Well, thank you for those thoughts. You're listening to Life Unrehearsed with Matt and Corrie, and we're talking about how we can best support bereaved children. And we have the very, very courageous Michael Hollander, his wife Dahlia Gutman, on the other line with us. Michael and Dahlia, we're going to bring it back to you. Once again, can't believe or can't imagine what you went through. This was in January. This is early this year, where you had lost your daughter at 2 years old. And people try to console, I'm sure, and sometimes there are wonderful gestures, and sometimes people may unknowingly make matters worse with some ill-advised comments. So could you, as bereaved parents, what do they need to hear most? What did you find most helpful?
For the children? You mean?
For yourselves as grieving parents, going through the grieving process.
I would say for me in particular, I think the most important is to show up and show up again and show up again, to be very compassionate, and most important also to offer direct help. It's very nice to say, if you need something, let me know, or I'm always here if you need me, but it's another thing to say, I'm going to do this and this and this, and then just ask, do you need it, do you not need it? And that really goes a lot further because it doesn't put it into the court of the bereaved person who has to make the decision to reach back out. Because really, it's not, I think the loss of a child is very different than other losses. And when you lose a child, I don't need somebody necessarily to do certain particular things for me that maybe I did if it was a loss of a spouse or the loss of a parent. But when somebody offers something directly and clearly, it's very easy to say yes. I think it's important to talk about the child, talk about their life, not just about their death, and specifically to recognize triggers that happen in the community or everyday life that may be difficult, and just to be sensitive to it, and sometimes just to preface things that happen with I know this can be difficult for you.
So wise and right out of the mouth of two people who are experiencing this for Dahlia, you alluded to it. We've been talking about it. What about the kids? How did you, or what would you suggest other people, what did you do, and what would you suggest for other people in terms of talking to their children about the child that died?
So I think you were very spot on with everything you said initially. Be open, tell the truth, because when truth isn't told, kids' imaginations could run wild. We need to do things age appropriate. And if you actually listen to the kids as they speak, you learn what's age appropriate for them, how an 8-year-old deals very differently than a 5-year-old, and each one in their own special way. I think we need to allow kids into the grieved world. I don't shelter my kids. We go to the cemetery. We talk about Ronnie. She's part of our life. We know she died. We didn't forget it, but this is how she lives and how they understand that it's okay. And I really think what's really important, and that this is something I think we need to work on, is the future the other caregivers, the school teachers, the camp counselors, those types of people. They don't necessarily see on the children's face or hear every detail of what they're suffering, but kids are different after grief, just like we are. You're not the same. And I think it's about being open, giving them an open voice in the classroom or at camp to be able to feel like it's okay to talk about and just to make it normal. And when you think about little projects that happen in school, like tell me about your family or draw your family, it could be really difficult for a kid who isn't really sure what they're supposed to do. Are they supposed to pretend their family's normal? What are they supposed to do? Include the person who died, not include, and just prefacing it by walking up to the kid or even in front of the classroom, because kids need to know that these things happen, not that they should be scared of them, but that they should know they exist. And say, whatever your family is, whether it's divorce, whether somebody died, whatever the situation is, that you can describe it however you feel fit.
That's such great words of advice, Dahlia. We have Dahlia and Michael Hollander. We're running out of time here in about 30 seconds or less. You started a wonderful foundation called the Ronnie's Joy Foundation. How could people find out more about that?
We have a few. We're working on our foundation now. We have a few specific links through the Starlight. You can actually probably Google Ronnie's Joy and find through the Starlight. We're working on improving pet therapy at the Children's when COVID ends and just bringing joy and happiness to 6 children. Also, I know Corrie Matt mentioned the Myra's Kids Foundation, which deals with kids' grief and acknowledging it and helping support them. And we have a few up-and-coming projects at the Montreal Children's Hospital for bereavement packages and helping support families who have gone through loss even after they leave the hospital.
Right, Dahlia Michael, thank you so much. And, of course, a shout-out to the Myra's Kids Foundation. Corey, you're so involved in that one as well. Thank you, both of you, for coming on the air. We really, really appreciate it.
Thank you for having us.
All right.
Thanks, guys, for all the work you're doing. I really appreciate it. And please know, Myra's Kids Foundation registration is now open for summer 2021.
All right, coming up in the second half, we've got, you want to contest the ticket? How about other COVID-related legal issues? You don't want to miss our rapid-fire Q&A with Jamie Benezri. That's coming up after the 4:30 news.